Hi Rob, I'm Belinda and today I'll be your assessor. So we will be conducting a pre-participation screening and the purpose of this is to let me know whether you have any medical history so that I can actually propose a suitable fitness plan that aligns with your goal. Is it okay?
Yes, okay.
So during the screening, I will ask you a few questions about your medical history, any current health conditions or exercise experiences, or any past injuries that you may have had. So as your safety is my top concern, I would like you to provide me with honest and accurate answers throughout the assessment so that I have the right information to make informed decisions about your fitness program. Okay, so here is a physical activity readiness questionnaire form, in short, which is the PARQ form. So this will allow me to actually know whether you need to seek for any medical advice from any doctor before becoming physically active.
Okay.
So I'll go through the questions question by question and you will take your answers accordingly. At any point of time you're unsure of anything, you can just let me know.
Okay.
So the first question is that, has your doctor ever tell you that you have any heart conditions or high blood pressure?
No.
Okay, great. And next, do you feel pain at your chest area, like when you're doing your daily activities such as walking or like to the kitchen, or when you do physical activity like taking the stairs?
No.
Okay, that's great. Next, do you lose your balance due to any dizziness that you feel, or have you lost any consciousness in the last 12 months?
I've never had any dizziness.
Okay, that's great. Then can you please tick? Okay, next, have you ever been diagnosed with any chronic medical conditions apart from heart diseases or high blood pressure? It can be like asthma.
No.
Okay, that's great. Next, are you currently taking any prescribed medication for any chronic medical condition? Or?
No.
Okay, that's great. Next, do you currently have or had within the past 12 months any bone, joint, or soft tissues such as muscle, ligament, or tendon problems that could actually make worse if you become more physically active?
I've never had this problem.
Okay, that's great. So last question is that, have your doctor ever said that you should only do medically supervised physical activity?
No.
Okay. So since your answers is mostly all no, so it actually shows that you are free from physical activity. So can I have you to sign here and write
My
your
name
name?
as well, right? Okay.
Yeah. And we will now move on to the next part of the pre-participation screening. So apart from those medical conditions that I mentioned, this is actually regarding your disease history. So do you have any known cardiovascular, metabolic, or renal diseases?
May I know what are those?
Okay, so renal disease is like any conditions that affect your kidney, and then metabolic disease are like type 1 or type 2 diabetes, and cardiovascular disease are like your cardiac conditions there's like heart failure or heart attack.
No.
Okay, that's good. Next, have you had any signs or symptoms of underlying cardiovascular, metabolic, or renal disease? So it can simply be like feeling pain or discomfort in your chest area, joint, arms, or any areas of your body.
No.
Okay, next I'll ask you a few more questions regarding to that, and if you experience any of it, please do let me know.
Okay.
So how about feeling out of breath or unusually tired easily?
No.
Having difficulty in breathing when you lie down or waking up at night?
No.
How about swelling in your ankles?
No.
Feeling of irregular fast heartbeat?
No.
Or experiencing leg pain during walking or exercising?
No.
Feeling abnormal sound in your heart?
No.
Okay, that's great to hear. So for this assessment, I will actually prescribe you some exercises that you can work on to actually achieve your goals. So for the desired exercise intensity, right, we will range from light to moderate to vigorous. So according to the ACSM pre-participation screening algorithm, so it actually like since you do not have any diseases or signs of symptoms, or like do not require any medical clearance, it is recommended that you actually start from light to moderate intensity first. And then when you're comfortable with it, we can actually slowly move on to vigorous exercise. So for example, like maybe exercise regularly, right, for you will be like 30 minutes for 3 times a week. And we will actually propose your intensity from there according to the recommendation for you. Okay, so lastly, during the assessment, there may be times where I need to maneuver or like guide your body. So can I have your informed consent to actually perform this adjustment if necessary?
Yeah.
So at any point of time you feel uncomfortable or you want to stop this, you can just feel free to tell me.
Okay, no problem.
So besides that, there are actually some pre-test instruction before the assessment that I will need to tell you and you need to comply to it. So before 3 hours of the testing, there is no exercise allowed, no alcohol, no caffeine from your coffee and all, or no food and no tobacco. No exercise on the test days itself also, and must ensure that you have ample amount of rest. So, and next is your clothes, right? Should be comfortable and actually freedom of movement. So the most common one will be dry fit and comfortable pants. And your shoes should be of walking or running shoes instead of slippers. And during the 24 hours period leading up to the assessment, you should actually consume sufficient water to maintain your hydration level. So do let me know if you are currently taking any medication.
No.
Okay, so that's the end of our pre-participation screening test.